Hello, I'm back. Sorry, have we got Steve's with us. Hurrah, good. Morning. Right, sorry about that, everybody. I just had a moment of thinking we had the wrong link that was sent out, but no, that was just me. So look, let's go in because I don't want to hold this up. We are recording this session for anyone who wants to obviously listen to this on a playback basis. But first and foremost, thanks for joining us today. We obviously last year held a number of sessions with Steve, who's kindly joined us again today as our resident virologist, and that was with the purpose of providing as much education and information to our colleagues with regards to how vaccinations work, etc. We now are at that point where we'd like to continue with our sort of program of encouraging and educating our colleagues so that we all make the right sort of informed decisions in relation to boosters in particular for this time. So I will stop my talking now, if that's okay, and hand over to Steve. And obviously, once I think Steve, you're going to give us a bit of an overview in terms of how boosters work. But then it'll be an open Q&A session if anyone has any concerns, queries, or wants some clarification on anything that we've covered off. So thank you.
Okay, sure. Thanks, Claire, and thank you everyone for welcoming me back. I was quite surprised after last year. But no, so really what I wanted to do today is just give a very quick catch up on how vaccines work, why we use vaccines, why they're better, by far and away better than experiencing an infection with a pathogenic virus, and why we need these booster shots, okay? And I think it's fair to say that a lot of criticism has been leveled against the vaccines because we need boosters, and I'll come back to why we need boosters in a moment. But just very quickly then, the whole premise of a vaccination is to train your immune system to recognize the small protein components of a foreign entity, a pathogen, a germ, a bacteria, a virus, whatever, because our immune systems aren't like muscles. They need to be programmed. They're an array of precision weapons which will specifically recognize the presence of foreign material in your bodies, okay? It has two main branches. One are the sort of foot soldiers, these T cells, which go around killing cells that are infected with viruses. We sacrifice those cells in order to stop the virus spreading, because the virus is what we term an obligate parasite. It needs us to survive and thrive and transmit on to other people. And the second aspect of our immune system is the sort of artillery, the B cells. They make antibodies. The antibodies stick to virus particles and prevent them from entering our bodies. The way the vaccines work is that instead of that process happening through an infection, where lots of alarm systems go off and our immune systems are programmed to recognize the specific parts of that invading pathogen, the vaccine provides the training without any of the real dangers that are inherent to being infected with a virus, okay? More than anything else, it's completely putting the cart before the horse to infect yourself with something that you want to become immune to, right? So back in the days when Jenner discovered, or at least promulgated vaccines, we were actually at the point where we were using, to fight smallpox, we were actually using a technique called variolation, which was actually to deliberately give people smallpox in order to make them immune to smallpox. And it was thanks to Jenner, who recognized that giving people the benign form of smallpox, this cowpox virus, still gave us that protection and enabled our immune systems to defend us when we then become exposed to the dangerous virus, okay? And that's really the principle that all vaccination follows. It's giving a safe form of something that will train our immune systems to react favorably against something that is potentially going to make us unwell. And we've been very fortunate with vaccines against this novel coronavirus. Most vaccines against coronaviruses that have been made in veterinary world, for example, don't really work, okay? These vaccines have been incredibly successful in training our immune systems to prevent that severe aspect of COVID, okay, the really bad events which land us in hospital a lot of the time with our lungs not coping with the infection. And in actual fact, it's because we make an inappropriate immune response a lot of the time that makes us severely unwell with COVID. So our vaccines have done really, really well to train against that. And that protection remains most of the time. The problem is that you cannot maintain that sort of vigilance in your immune system for too long, because if you do that, your immune system becomes potentially exhausted. And there's also the potential for it actually being relatively damaging to maintain that sort of defense system for too long. It's almost like closing the weapons back away in a weapons locker. You don't want it continuously activated. And also, if you think about it, the number of germs we get exposed to year on year, if we maintain this high level of alertness and response to those germs, then our blood would just be thick filled with antibodies and would be continuously making reactions to things. Okay, so our immune response purposefully switches itself off over time. Okay, now the consequences of that happening when the pandemic is still going on and the virus is changing and becoming variants that are better at bypassing those antibody defenses that we make, is that infections happen again. Okay, our antibodies start to go down naturally, whether that's in response to infection or in response to vaccination, because we can't maintain that level in our blood the whole time. Okay, so infections start to happen again. And the problem is that not everyone makes the best response to vaccines, and not everybody maintains that protection against severe disease. Okay. The other issue is that our vaccines are based on the original virus that came out of China and infected the entire world. And as I just mentioned, the virus has changed again and again and again, mainly because of the sheer scale of the infection across the planet. And so now we know that first of all, with Delta to an extent, and nowadays with Omicron, this virus is a slippery bugger. Basically, it can slip past these antibody defenses and infect us again. And even if we have had our vaccines, there's still a small chance that something could go awry there. We don't always respond in the same way to an infection every time we get it. So the real driver, and this isn't meant to be a political statement, but it is a policy statement, the real driver for the need to boost our immune systems with more vaccinations is the fact that the virus remains prevalent in our society. Because if our immune systems were gently dampening down, but not being exposed to the virus again, then it wouldn't be so much of an issue. But the fact is that we've actually got record prevalence in the country at the moment, even though it's apparently okay to switch off testing and that sort of thing. Don't get me started on that. But the fact is that if our responses are going down and the virus is still there, that's when we have issues, okay? So we boost. And the government is following a course that's similar to the strategy that we have used for many years for influenza. SARS coronavirus 2 is not influenza. Influenza is not to be underestimated, but they're not the same virus, okay? Now, this virus is still with us. It's still pandemic. It's still causing problems. There are many people in the country that aren't actually vaccinated. But the problem is that those vulnerable people, categories that we heard about right from the start of the pandemic, the older people, people with underlying conditions, people with different medications, and indeed people that just don't respond to things in the same way that everybody else does. We're all genetically diverse. We don't all make the same responses to vaccines, okay? There's still a chance that another infection or another challenge with the virus is probably better to think about, because it's never black and white. You're always faced with a virus challenge. Your immune system is in place. They're ready to fight it. The steady state, the readiness of those different things can be different. We're in a dynamic situation. It's not static, okay? Nothing's ever 100%. So what you find is that over time, our antibodies in particular start to go down. They're not always the right antibodies, certainly against Omicron and the new variant, subvariants of that. And so you still see reinfections and reinfections and reinfections. Our children are generally not well vaccinated, and many other people have chosen not to have vaccines. So one reason to boost is literally to restart that big response that we had previously from the vaccines in the first few months after we've had them, after the first 2 courses. And that's really good if you can focus that in the people that we know are more likely to be vulnerable against disease, okay? It's not, in my view, a sustainable strategy, but it's the strategy that the government is adopting, okay? The other reason, though, that boosters are a generally good idea, particularly because there's this mismatch between the vaccines that we use and the viruses that are now circulating in 2022, is that our immune system, again, isn't static, okay? We have this array of precision weapons, but actually these weapons can self-learn, they can evolve, and they can actually get better at their job, okay? And when they're stimulated over and over again, they get better at making the weapons that they need to tackle that virus. And you can see this because you may have heard the idea of neutralizing antibodies as opposed to just general antibodies, the neutralizing aspects, so that the type of antibodies we make that really stop that virus infecting our cells get better and better with more boosts that we have, okay? It's a process that's called affinity maturation that happens in our B cells that are laid down as memories after our first vaccines. So whilst our responses go down naturally over time, we lay down a memory in our bodies of that response, which means that the next time we see that virus, we're ready to fight against it all the more. And we're not having to run that catch-up race that we did the first time that we might have seen the virus before we'd had a vaccine. So I don't want to dwell on anything too much, but the reasons for boosters again are: A, we still have this virus with us in abundance. 2, our responses do diminish over time. That's perfectly natural. It's not a failing of the vaccine. It's what happens in our immune systems. And B and C, sorry, it really is a question that boosters can make your responses all the better. So we're in a difficult situation. We're in a difficult circumstance that requires these boosters to make sure we're all efficiently protected against this virus, which really ought not to be underestimated still, even now that we seem to be moving on and supposedly living with this disease in the same way we do other colds, which is frankly rubbish from a virological perspective. So I won't go on any more, and I'm happy to take any questions around what people want to know about the boosters, and I apologize if that wasn't abundantly clear.
Thanks, Steve. Any questions from anybody?
I think I've just got one question, if that's okay. From my second vaccination, I really suffered with my glands. And they did say that I might, if I have the booster, I might have even more severe problems with the pain with my glands. Can you shed any more light on whether that's likely or not? Because that's mainly the only reason why I'm not getting boosted, as they said, because I suffered a lot. And obviously the glands swelling went down after 9 weeks, but it was very painful for 9 weeks. And they said, when you get boosted, you might have the same thing again or worse. So what's your thoughts on that?
Yeah, I mean, vaccines are provoking a response in our immune systems, and your glands enlarging and swelling up is precisely that. That's where your B cells and T cells are being trained to do their job, okay? So that it's part of what we call our lymphatic system, right? So if you happen to be someone who genetically is sort of pre-programmed to respond in that way to the certain stimulation that we're giving, then I'm afraid it could happen again. I won't lie. Could I ask which vaccine you had before?
It was the Pfizer both times.
Pfizer both times.
Comirnaty one, I think.
Yeah, Comirnaty, yeah. So, I mean, yes, that can happen. You may get Moderna this time. You may get Pfizer. They're essentially the same. The Moderna's got a bit more of the RNA in it, and sometimes gives a quite more vigorous reaction. Now, it's not true that if you have a reaction like that, you're necessarily making the best immune response to the vaccine, right? But it is a sign that you are making a response, okay? It is something that's unfortunate. It's something that could happen if you were infected as well, okay? It's just part and parcel of our immune system that does that. Yes, it's very unpleasant, and I'm really sorry to hear that you had that. And let's not beat about the bush. There are responses to these vaccines which aren't pleasant at all. You know, no one lies about that. There's a lot of pharmacovigilance that happens as we're using the vaccines in the community. The pharmaceutical companies are obliged to follow up on it. The MHRA are obliged to follow up on it. And yes, these sorts of reactions are quite common, unfortunately. But as with any medicine, and if you take a packet of pills out of your cupboard, there will be a leaflet in there, which most of us never read. But there's a huge list of rare side effects to any medicine, okay? With vaccines, it's often very clear that it's something that, you know, happens to a lot of people because it's our immune systems. And our immune systems really are a powerful response in our bodies. It's something that's unpleasant and uncomfortable, but is not really ever going to be in any way dangerous, if that's any kind of reassurance to you.
Yeah.
There are some adverse reactions to vaccines which can be dangerous, but they're extremely rare. The Pfizer vaccine tends to only really cause problems in young teenage boys. In very small numbers, they can develop an inflammation around the heart called myocarditis or pericarditis. That in itself is extremely rare. It's very mild, and actually you're more likely to get that sort of response to COVID. And similarly, all of these things should be weighted against the fact that if you were to develop severe COVID, then what you would experience would almost certainly be much more unpleasant than a swelling of your glands. So I'm afraid I can't say you won't get that reaction again. If an appreciable amount of time has passed between your second vaccine and your booster, that possibly makes it less likely to happen. So if it's more than 3 months, whatever it is, then that could mean that it's less likely to happen. But obviously, hand on heart, I can't guarantee that won't be the case, I'm afraid.
No, that's lovely. Thank you.
Okay. Mike, got a question?
Yeah, it's not a question really. It's just to sort of share a bit of a personal story really. So I've had both of my vaccines and the booster, and I joked 2 weeks ago that I dodged COVID and then caught COVID really. So I was expecting to be really, really ill. So I'd day 1, day 2, day 3, I was thinking, right, when's it going to hit me? When's it going to hit me? When's it going to hit me? I did my test on day 5, was negative, day 6, negative. So when I had my vaccinations and my booster, I probably had some mild side effects for 24 hours, but COVID didn't really impact me at all. And I know friends who've not had the vaccinations who've been really, really, really ill. I've had worse colds than what I've had with COVID. And a colleague said, start taking vitamin D. I started taking vitamin D. Effectively, all I had was a head cold and mild sinus pain. So I'm really pleased I had the vaccines and the boosters, and I'll sort of take it all day long. If that's it really for me, every day I was expecting it to get worse, and it never did. And if that's it for me, yeah, I'll advocate vaccines and boosters all day long. So that was I just thought that might be helpful.
No, that's really good to hear, Mike. And it is certainly the case that the vast majority of people who have had their vaccines, and especially if they've been boosted, are experiencing extremely mild courses of disease now with COVID. It's not universal. And the problem is that, what we're doing by vaccinating is reducing that chance of people developing severe disease as a result of infection. You can't ever say it's 100% because, as I said, we're genetically diverse. We make the right or wrong responses. Most of us make a really good response and we're fine. It's like a bell-shaped curve. There are going to be some people that make fantastic responses, some people that don't though. And those people may be older, they may have underlying conditions, or they may just genetically not have the tools in their toolbox to make the right response. And so that's why the problem that we have at the moment really is prevalence, in my view, because if you have a small chance of something happening, if you're multiplying that by a very large number, then the real terms chance of something bad happening is going to be that much bigger. So that's the problem that we have at the moment, unfortunately. That's why the boosters are really important, because they make your response against disease really good. They are less effective at preventing infection. Now, that's partly because this Omicron variant is very different to the virus that we had circulating last year and the year before. And so, unfortunately, we don't, if you think about the different arrays of weapons that we're making, the antibodies that we're making, we're not all quite good enough to make, well, not good enough, it's not the right way, isn't it? We're not programmed in the right way to make the response against the Omicron spike. But the nice thing is about having been vaccinated and boosted is that when that virus does get in, it's faced with all sorts of other problems, and we're well ahead in the race, and you don't tend to get that unwell from Omicron if you've been vaccinated and boosted recently. You can overcome that deficit in the antibodies that you make if you've been very recently boosted, just literally because the levels of everything is high enough to make good on that one. But as we're seeing with Omicron, it's reinfecting and causing problems. The other reason to get boosted is that the protection from infection that you get is important, because there is this issue around long COVID, which I meant to mention before. Okay, and long COVID can happen regardless of how severe your disease is. Okay, it's something we don't really understand. It's something that vaccines do help with, but it can still happen. So, you know, again, my view is that we shouldn't be running at this very high level of prevalence, but it's still all the more important to get boosted. Lorinda, have you got a question?
Yeah, I was just going to ask regarding the next wave of vaccinations.
Yeah.
I know that people like Mike and some other colleagues have only had mild symptoms of Omicron, but personally, I did suffer quite a lot with it. And I know other colleagues have as well. So, you know, there's 50-50 whether it's affecting you or not. What is the likely effects of having the booster and then, you know, getting symptoms? Because I know a lot of people have had reactions to the boosters. So what is the likelihood, you know, if you had a bad case of Omicron to what you would have with the booster? Does that make sense?
Yeah. So you're saying, had you had a booster, would you have been less likely to have had severe?
I've had all my boosters. I've had all the injections. Right. So yeah, but
and then you got Omicron, and it was bad, right?
Yeah, and then like with the next lot of boosters that are going to be coming out.
Well, if you've been
what's the likelihood?
Yeah, it's difficult to say, Lorinda, because, you know, as I say, we are all genetically diverse. These vaccines, they act with our bodies to reinforce the responses that we're naturally capable of doing. Our immune responses are defined by our genetics. The way in which we recognize foreign material, the way in which we respond to foreign material is defined by our genetics. And so because we are all diverse, you know, we all experience different symptoms with the same cold, for example. You know, if we weren't talking about COVID, you know, some of us will get a vomiting bug from our kids, some of us won't, and yet we're still in the same house, okay? Disease is always a function of the virus, the pathogen, the bacteria, whatever you're talking about, your immunity, which is defined by genetics, and the environment. So it may be that you're run down for other reasons. It may be that you're malnourished. It may be that you're older. It may be all these other things. But resilience can impact things about that. Mike mentioned vitamin D. Vitamin D is something which many of us are deficient in. It does help with respiratory infections in general. It's not specific to COVID. And some people that are promoting taking bodges of the stuff as a therapy are misguided, right? That doesn't work. But not being deficient in vitamin D is really important, okay? So all of these things act together to give you what we would term pathology. Now, if for whatever reason, you just haven't quite made the right response to protect you from Omicron, then you will get better responses the more you boost. You will get better responses from having been infected on top of a vaccine. It's not a pleasant way to do this, as you've just found out, unfortunately. And the problem is that with any infection, there always carries a risk of nasty disease. Okay, we can't say that every time you roll that dice, you're not going to roll 2 ones. All right, so this is the problem. But all you can do is hedge your bets. And so the more that we have to boost because of the virus being present, the better it will be for people who would have been otherwise less likely to respond favorably. Does that make sense? You can't say on an individual basis, I'm afraid. As a population, we will get better responses the more we boost. The reason that we are having to boost people over 70s again is because the virus is here again. They are losing the protection against infection, and because they are older, they are more likely to have responded less well to their previous vaccines. Yeah, does that make sense? So it's not just the fact that the vaccine stopped working. It's not about the vaccine really. It's about our response to the vaccine. It's about our genetics. It's about our well-being, and about just how naturally immunity ebbs and fades, because we, as I said at the beginning, you cannot maintain that level of response the whole time. So the easy solution is to get rid of the presence of the virus, but we appear to be reluctant to do that in this country. Does that answer your question?
Yeah, thank you. Thank you. That's really helpful.
No worries.
Hey, Steve.
Oh, hi, Claire. Sorry.
Hello. Just something that I've received some feedback through some female colleagues, sort of more recently, and they've commented on, since having their first vaccinations, their double vaccinations, that they have experienced changes in their menstrual cycle. So two questions here. One is that a known side effect? And two, they're slightly concerned about having the booster vaccination because is there going to be a further ongoing impact to their cycle going forwards?
Yeah. So yes, that's a known issue with not just this vaccine, with other vaccines and with infections. So some of the chemicals your body makes during your menstrual cycle are actually linked with inflammatory responses. So some of the prostaglandins that actually cause you to shed the uterine lining, something called prostaglandin E2, if I remember my physiology right, those sorts of things are involved with the way in which the menstrual cycle goes. So if you have something which artificially, well, not artificially, that's not the right word, but otherwise wouldn't have happened to stimulate your immune response, and yes, that can affect your menstrual cycle. It should not last for very long, a matter of months at most. It certainly doesn't make any difference to fertility, as far as I'm aware, and it certainly doesn't make any difference to unborn children in the womb. We know that from multiple studies. There was a horrendous poisonous falsehood that was circulating around female fertility around the first vaccine spread by a guy called Michael Yeadon. That was absolute nonsense, but unfortunately it did put a lot of younger women off having the vaccine. So yeah, I'm afraid that there is a small chance of some people's menstrual cycles being disrupted, hopefully not too badly and hopefully not for too long. But that's a general consequence of inflammatory responses. And I guess that the probability is that had they contracted severe COVID, that would have also happened.
Okay, thanks.
Okay.
Any other questions?
Helen?
Yeah, I just wanted to ask whether you think going forward now, sort of as we live with COVID, we're going to be in a cycle of boosters. You referenced the 70 pluses are having another booster. Is that kind of where we think we might be moving towards, or we just have to wait and see?
There's a difference here between what I consider to be scientifically a good idea and what the policy is. Okay. This is the choice the government have made. Okay, they've decided to essentially make the assumption that vaccines will protect the majority of people from severe disease for the time being. They know that that isn't long lasting entirely, and that if they do just leave it to vaccines, then they will require boosting programs. And so what they're hoping is that eventually the world will get on top of SARS coronavirus to reduce the levels. We may see it become endemic at some point at a low level. Endemic does not mean benign. Endemic does not necessarily mean there aren't any infections around. Endemic has been used very callously by certain people and certain newspapers to say that this virus is going away. Endemic just means predictable. Okay, TB and malaria are endemic in Africa. They kill lots of people. HIV is sort of endemic. Smallpox was endemic in this country. Polio was endemic in this country. Measles is. Chickenpox is. All different levels of viruses, all different levels of disease. Okay. Whilst we have infections at the very high levels that we're seeing, and these surges of virus infections that are coming because the virus elsewhere around the world, or indeed in this country, as we saw with Alpha, is changing and evolving and presenting us with different challenges, then yes, one way to deal with that is to continue boosting the people that might otherwise not make the best response. We do that with influenza, but then again, that isn't actually always that effective. And we vaccinate loads of people for influenza every year in a suboptimal way. The take-up's never brilliant. And unfortunately, people do die from it. But I'm not about to start comparing influenza with COVID. It's very different. Most of the deaths caused by flu are due to secondary bacterial pneumonia. They're not due to the virus itself. That's different to COVID. COVID's got all sorts of other longer term problems. So my view would be that you need to do belt and braces. You need to reduce prevalence, and you need to therefore boost less often. And also what makes a difference is what we're going to boost with. And that's a really hard one, because now in this country, we've got a huge mosaic pattern of immunity. We've had different vaccines, we've had different infections, we've had different sequences of those things happening. And it's really hard to define our population immunity, if you like, against different types of the virus. And we're seeing that with BA2. You know, Delta was reinfecting people that had had Alpha in a sort of moderate number. The first Omicron wave, we saw huge numbers of reinfections. And now this quite similar virus, that's what we call a subvariant of Omicron, is different enough again to give us a huge spike of infections, which we're not really hearing about in the news, but is happening. And so those consistent challenges are going to mean that if we want to avoid large numbers of people getting severely unwell, then yes, I'm afraid we will be stuck in a cycle of boosting. That's a policy choice that has been taken. So yes, I believe we will continue to have boosting programs, because that's the policy that's been followed. Frankly, I think it's crazy, but that, I'm afraid, is going to be the way that they're dealing with it going forwards.
Anything for anyone else? No? Okay, well, thank you so much, Steve, for your time. I hope everyone's found it useful. I've certainly learnt more things as well, so thank you. What I would say is that for anybody who's dialed in, if you've got any questions, say that you want to ask offline on a one-to-one basis, please do let me know, and then I can arrange for perhaps a follow-up call with Steve as well. We've done that previously, and that's helped a number of individuals, so that offer still remains outstanding. But for now, thank you all so much for joining, and thank you, Steve, for continuing to help us on this journey.
That's a pleasure. Can I just finish, Claire, by just saying, you know, that there's nothing about having a booster that's any different to the risk that you would have had from having your first courses of vaccines. It doesn't matter if you have had a different vaccine previously. These vaccines work together, and in fact, if you're using a different sort of vaccine, that can sometimes give you an even better response. So don't be put off if you had Pfizer before and you're offered Moderna, if you had AZ before and you're offered Pfizer. These things all work together really nicely and should give you much better responses going forward. And unfortunately, if you do happen to be hit by Omicron, then you want to have as many jabs in your arm as possible, because we don't also know what the next variant will be like. Omicron is less severe than Delta. It's not really not severe. It seems to have a different pattern of infection, but it certainly isn't something to be underestimated. And the next variant, we could be more like Delta or other things that we've seen previously. So please don't be fooled by certain people saying that this virus is now no longer a consequence. If we don't maintain our immunity, then you're going to tip that balance back towards severe disease again. So it really is important, given that this is the course that the government have decided to follow, that if there is a need for boosters because of prevalence, that we should engage with it, and we should take it as we can. But always remember, we're in a very privileged position in this country to have access to these sorts of vaccines, to this number of vaccines, and they're safe, they're effective, they're safe for children. Please ensure that everyone that's offered a vaccine takes one up.
Right. Thanks, Steve.
Okay.
Okay. Have a great day, everybody. Thank you.
Take care, everybody.
Thank
Bye-bye.
you.
Bye.
Thank you.
Cheers.